Okay, welcome everyone to the Finance Committee meeting of November 23rd, 2020. Just a note, I believe Nicole Terminelli is in parent-teacher conferences and will be joining us later. And she said that Susan Fiasco would be commenting on every resolution in her stead. Is that true? Yes, she's nodding affirmatively, okay. So first is the call to order and approval of tonight's agenda. Moved by Mr. Forsyth, seconded by Mr. Lightfoot. I'd like to see an amendment to this, and I'd ask for a motion to amend the agenda to move the resolution 11A to 3A, immediately following the COVID-19 update. And the purpose of that would be so that Dr. Williams and his cohort from Claxton Hepburn could join us and we could immediately move into that discussion. Move for amendment by Mr. Arquette and seconded by Mr. Perkins and Ms. Haggard and Ms. Recurrent. All those in favor, any more discussion about the move to amend tonight's agenda? Seeing none, all those in favor of amending the agenda signify by saying aye.
Aye.
Opposed, motion carried. Motion for approval of the minutes of October 26th by Mr. Sheridan, seconded by Mr. Denisha. Any discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Opposed, motion carried. Okay, so for our COVID-19 update, we'd like to welcome Dr. Dana McGuire and Dr. Andrew Williams.
Good evening, everyone. So for tonight's update, we are currently at 754 cases to date. We currently have 12 people in the hospital. 135 cases are active, meaning they're currently in the isolation process, and 613 have been through that process. We are up to 9 deaths since the response started. And if you check the state tracker, this has not been updated yet. So we have had 3 recent deaths. This shows our increase on a daily basis as I normally show. And you can see that the rise is quite steep. On a weekly basis, keep in mind that last bar is still missing one of the days in the week. So we have had 124 cases so far this week. So we do have one more day to report a full week. And as an average daily, we're now at about just over like 20 cases. It's a 500% increase since the beginning of October. If you look at some of like the events we have had since the start of the response, if you look at the number of new cases every month, and then the cumulative cases that you see each month, you can see that's where the rise really is. We do continue to track those people who have symptoms. So this month, you'll see that much more, and our hospital rate has been up. So during this month, we have seen just over 30 hospitalizations in kind of total. The average age of cases has bounced, just around a little bit. It seemed to lower when we were back in session for both college and K-12, and most recently, we're on an increase as well. The average age of deaths is 77 years. For those people who are in the isolation and the quarantine process, if you look at that small number, that 38, those are the people who are in precautionary. That group is still like the traveler group. So we're seeing less of that. And that's also probably due to like the new way you can test out. So that is not a group that we see anymore. That's kept by the state. That 135 is who is in active isolation or is hospitalized right now. And the group at 7:35 are the people who are in the mandatory quarantine. We have seen that kind of number come down, and that could possibly be due to the number of the cases we've seen linked by the family members. And so if you're currently in quarantine and then you find out that you test positive, it's likely that you won't have just as many of the contacts because you were in that quarantine process when you found out that you were positive. So at the beginning of this month, we had 410 cases, and we're currently at the 754. So that's 300 and just 41 cases for this month, and we're not quite done with this month. So it's possible that we could see half the cases that we've seen for the full response just in this current month. We're always kind of wondering when we might enter one of those microcluster zones. And you can see on the map that Lewis County has gotten there. And so we continue to watch our areas and to keep in mind that if we were in the yellow zone, that is where we would have to test schools at like 20% per week. And there would be some restrictions on the worship, mass gatherings, and some of the dining. So we are watching that, and we are speaking with the state. We really tried to think about what we could do for Thanksgiving, and I know this slide is small, but as a county, we did put out an email to all the employees and really asked them to try to give us ideas for what they were going to do that might be kind of different this year, because we know the gatherings is where we can see an increase in cases. So many people did mention that they're going to do a Zoom, possibly during the end of the meal, or do a fun game with their family members. There was a focus to stay local, so not to travel, and to purchase here locally. But some of the other fun ideas we're thinking about when you could just decorate your home for the upcoming holidays. And there was a neat suggestion of, since there won't be like the Macy's Day kind of parade that we see every day, that they were going to make up their own. So I know it's really hard this year, but it is in those small gatherings that we are seeing an increase of the cases. We have seen them in the birthday parties and things like that, and so it doesn't have to be large. And it can be people that are in your family, but in an extended family. The people that you normally spend time with, these kind of cases can occur. So as we always talk about, it's really important for these recommendations, and these are kind of coming about even more and more. So wearing a mask, doing the social distancing, and washing your hands is actually a focus that we're going to take this week. Just that kind of making sure that you have good hand hygiene, making sure that you're cleaning and doing the disinfection of all surfaces. And there was a recent study that looked at last fall compared to this summer of what the hand washing practices were of those in the United States. It did show that people are increasing that they do wash their hands. It's still only 1 in 4 people don't wash their hands after they sneeze or cough. They go take a meal outside of the home, and whether they use the bathroom or touch their mask. So now is a time to really be thinking about hand hygiene, washing them, or using hand sanitizer, when you don't have a sink. One of the things that people, I think, sometimes think is, I can do one of these recommendations and then I'll be safe. It's really important to keep in mind that just because you're wearing a mask, doesn't mean that you don't have to wash your hands or you don't have to do the social distancing. These 5 things, all in practice, are just really important. And then one of the other things that we made a change for in the department this week is that we won't be putting out the exposure notices. At this time, with the increase in the cases that we've been seeing, we would have those notices all over the county. And so it's really important to know that no matter where you go or what you do, you know, whether it's going to work, whether it's going to church, whether it's going to a store, you should assume that you have the possibility to be exposed. And we all need to act in a way that the person next to us could possibly just test positive. So it's really important at this time to keep all of these recommendations in place. And again, before Dr. Williams speaks, just want to remind people of all the testing sites. It is extremely important to self-isolate after you get your test. We do have, you know, some people who are testing, they go back to their families. They're just kind of coming home. They're going to be coming for the holidays. They might be waiting for a test. And so it's really important when you don't know your status that you do try to stay away from others, make sure you wear a mask and all of those things until you get your test results. At this time, that is all I have for this evening. Dr. Williams?
So good evening, everyone. I'm going to go ahead and just give a brief update and then talk more specifically about some testing options that I believe were discussed at the meeting last week. So as far as COVID and national trends, what we're seeing is, again, a significant increase across the nation. We have an average daily new cases of more than 170,000, which is a substantial increase. We also are seeing approximately 1,500 deaths per day. There have been some days where there have been nearly 2,000 deaths per day. So we have more than 255,000 deaths, more than 12 million confirmed infections, about 1,500 deaths per day, and around 170,000 new cases per day, which is nearly a 60% increase from what we were seeing 2 weeks earlier. So what we're seeing in the county is really a reflection of these national trends. We also see that if we look at our 7-county region, the 7-county region has more than 12 cases per 100,000 inhabitants. St. Lawrence County, as Dana just said, is closer to 20. As far as percent positive tests per day, and this is an important value when I talk a little bit about microclusters. So it's 1.8% per day for our region. It's something similar in St. Lawrence County, if not slightly lower. And the reason that's important to keep in mind is that when you look at the guidance for when we become, or if we were to become a microcluster, we're considered a tier 3 county, which has to do with our demographic, our size. But it's both based on new cases per 100,000. And the cutoff for that, whether you're yellow, orange, or red, is actually 15 cases per 100,000. So we're over that. But what we're not over is the percent positive of testing. And to enter the yellow microcluster status, you have to be above 3.5% for testing. And we're quite far from there, which is really a testimony to the extensive testing that we do currently do. I did want to just briefly mention a vaccine update. So people may have seen in the news today that AstraZeneca, which has a slightly different type of vaccine, is reporting that their vaccine has shown up to 90% efficacy. Moderna had previously announced that they were 95% effective. The next step for them is to get their paperwork to do their FDA emergency use authorization. And Pfizer has a pending FDA EUA. That's supposed to be reviewed in early December. I did want to talk about testing because I know some of this conversation is going to turn to an instrument called the Rheonics. So we reviewed this earlier in the summer, but basically of the kinds of tests that can be done, what's called a lab-based PCR still remains the gold standard. So compared to other tests, there are fewer false negatives, and there's also fewer false positives. And as we know, false negatives have important implications, but false positives can also be important. Antigen testing or point of care molecular testing is available, but it's less accurate. And there remain questions about whether it's appropriate to use this in people without symptoms. So right now, in terms of what we can do in St. Lawrence County for community access to testing, we do have these different options. So St. Lawrence Health System has 4 testing sites. As I'm going to talk about, samples are collected, then they're sent to reference lab. Claxton Hepburn has the respiratory clinic, where they also collect tests and send them to the reference lab. Community Health Center of the North Country does have the ability to do a limited amount of rapid testing with molecular testing, and we also send to reference labs. And then there's an independent urgent care where they do rapid antigen testing and also send to reference labs. But right now, there's nowhere in the county where you can get a rapid or same-day PCR done. I do want to talk about the difference between a collection site and a testing site. So I continue to refer to our local sites as testing sites for COVID, but really for the most part, what we're collection sites. So our staff at these sites collect the swab, and then they send them to these reference labs, primarily LabCorp, but also Mayo Clinic, UVM, and Broad Street. That's where the testing actually occurs. And in order to get these samples that we collect to the testing sites, there's either a ground-based courier or an airplane-based courier. And that's where you see these turnaround times. Right now, the turnaround times, they can be as short as 2 days, but we're seeing more consistently 3 days to 5 days. And there's occasionally a test that takes about 10 days to come back. The problem with the 3 to 5 days and certainly the 10 days is, from a public health perspective, it's very hard to manage when you're getting this data so far away from the time the test was collected. And as many of you know, when you get tested, you really want to have an answer as soon as possible so that you can start the process of isolating and also informing other people. So there's a device called the Rheonics, which is made for small to medium hospital-based labs. And the idea is, if we have Rheonics machines in the community, we can do the collection, but then you can also have the instrument in one of these labs. And within about 4 to 5 hours, you either know whether you're negative or positive for COVID, and you know with much greater accuracy. So there's some significant advantages of Rheonics. So it's considered accurate because it's a lab-based PCR. They quote sensitivities and specificities in the 90 or higher range. The cost for each test is relatively low. So the reagent costs about $27. It doesn't factor in the cost of the instrument. It doesn't factor in the lab technician, but it's still a relatively low cost. It can be managed by local hospitals. And as opposed to the PCR testing that's done at LabCorp, once we send those samples to LabCorp or to BioReference or to Mayo Clinic, they're really out of our hands and we can't control, we lose that local control of the tests. So same-day results are tremendously important. And again, when we talk about testing people who are symptomatic or even testing people who are pre-symptomatic or without symptoms at all, being able to find the answer the same day is really critical to an effective public health response. I know a number of questions have come up about Rheonics, and so I thought I'd try and anticipate some of those questions and provide answers. Obviously, there'll be an opportunity for discussion. So one of the questions is, will there be ongoing access to reagent? So if you recall from previous discussions, there's the instrument. There are the swabs to collect the specimen, but then for the instrument to be able to run the test, you need what's called reagents. And Rheonics, in conversation with them, it's an important part of their business model that when they sell the instruments, they essentially make a promise that reagent will be made available for people who have purchased the instruments. I also want to just mention that Rheonics is based in Ithaca. There's a long-standing collaboration between researchers at Cornell and the folks who run Rheonics. So it's if not a local company, it's a regionally based company with a nice track record. One question I think that appropriately comes up in this context is, if it's a good test and you can get same-day results and they're accurate, maybe St. Lawrence County should buy a machine and have the Department of Health run it. And in a more perfect world, that may be what should happen. However, the Rheonics is considered by the regulatory statutes regarding labs to be a high complexity test. So unlike some of the tests that can be done in a physician's office or can be done in a community health center or by public health, it's not CLIA waived. And so you have to have trained licensed lab technicians to run the machine. And there's certain standards that have to be maintained that really can only be maintained by a lab that has a certification to do high complexity tests. And so in other words, it's not possible for the Department of Public Health to actually have these machines and to run them. Another reasonable question is, if these machines are so great, well, why don't the hospitals already have them or buy them? So I think it's important for people to realize that St. Lawrence Health System, before this discussion started with the county, we recognized that this was going to be an important tool. And so we've already purchased several machines and actually have an intention to purchase several more machines because we think that they're likely to be so useful. Which brings up another question is, do we really need this kind of testing capacity? And I think there was discussion about what each instrument could actually perform. And so I want to just be clear that when you look at the number of tests that are done in our county on a daily basis, there's a wide range. And on the weekends, we don't see quite the same numbers, but at least during the weekdays, there's somewhere between 1,000 and up to 3,000 tests that are done throughout the county. And approximately 90% of those labs are sent off to reference, of those specimens are sent off to the reference labs. Each Rheonics instrument can run approximately 88 tests per 24 hours. The manufacturer says that if you run them full bore and have a full staff to monitor and maintain them, you can maybe get up to 105 tests per instrument. So in other words, having 2 additional Rheonics machines in the community will be important, but even if St. Lawrence Health System has 10 machines or 12 machines, that's not going to meet the need for the entire community, but it'll get a lot closer to doing that. So I know there are a lot of questions. I think Brandon Boline from Claxton Hepburn is also here, and I would defer to Mr. Akers whether he wanted Brandon to say his part or have discussion next.
Sure, let's welcome Mr. Boline. He represents Claxton Hepburn. Mr. Lightfoot, as chair, should we open this up with the resolution, or we have our discussion and then the resolution?
Well, I think he's giving a report, okay. So I think either way, up to your discretion.
So if it's up, since it's up to me, let's have the discussion and then we'll bring up the resolution, and Dr. Williams will still be with us, and actually Mr. Boline. So Mr. Boline, would you like to introduce yourself to the legislators, please? Welcome.
Yeah, good evening. Good evening. Thank you all for the invitation tonight. My name is Brandon Boline. I'm the Chief Operating Officer for Claxton Hepburn, and joined the organization in late February. And then about a week later, we went into all things COVID. So that's been my experience, at least thus far, with the organization. I appreciate you having me tonight, and would be happy to answer any questions to the best of my ability.
Okay, so let's open it up. Who would like to ask the first question of either Mr. Boline or Dr. Williams? Mr. Berg.
There was mention that this Rionics could do other tests in addition to COVID. At least I think that was mentioned. Is that accurate?
So the manufacturer is in the process of producing reagents so that we can test for influenza and also for RSV, which is a common virus that tends to affect pediatric patients. It's not, they don't have their FDA EUA for that, but they anticipate they should have that at some point later this fall or early winter.
Follow up, if I could.
Yes, go ahead, Don.
Trends. Dana showed us the graphs, and we know the numbers from today. I guess I'm wondering what are the projections for infection by our public health department, and maybe you could talk a little bit about what metrics are we using to assure that we're doing everything we can.
So, and we can certainly let Dana answer this. Well, I mean, I think looking at the numbers, it's hard to think they're going to do anything other than go up for the next weeks or possibly months. The variables there are introduction of a safe and effective vaccine, and people's behaviors. I think, as we talk about the 5 pillars of prevention at each of these meetings, we talk about them not because Dana has a nice graphic to illustrate them, but because they're critical. So I think if people in the community take those measures seriously, I think there's a chance that we can still flatten the curve. Certainly, we're all looking forward to the winter holidays. People have family, or if they don't have family, they have friends. We're all looking forward to having a meaningful holiday season, but it's, viruses, pandemics thrive on group gatherings. And if people don't take appropriate precautions, I can't imagine this is going to go anywhere except more cases.
Okay, thank you. Mr. Sheridan.
Yes, Mr. Boline, how many of these testing Ronex machines do you have at Claxton right now as we speak?
So thank you for the question. As Dr. Williams described, the majority of our tests are sent out through a vendor, LabCorp, for processing, analysis, and then test return. We have in-house testing capability, but to date, the rate limiting factor for us has been the resupplies, as Dr. Williams referenced. The reagents, those are just hard to come by. And so having something like the Rionics and the assurance that we could continue to operate that, give it at its maximum capacity, would certainly be helpful for us and for the community.
Okay, thank you. Who else had their hand up? Mrs. Haggard.
Thank you very much. Dr. Williams, I called Rionics because I had some questions. And one of the things they told me, and I'm a teacher, you're a doctor, please help me here. They test for flu, A and B, RSV, also STDs. Have you ever heard that?
So most of these devices, they're called multiplex analyzers. So the platform is capable of testing for a variety of different, what we call pathogens. When I reviewed some of their literature, I think some of their initial applications was actually in the agricultural industry, testing for listeria and other pathogens that might be found as contaminants in milk. So one of the advantages of these machines is they can be, if you have the right reagent, you can often test for all kinds of different things. As far as I understand, the influenza and RSV option is in development. If they had some more, contemporary news than that's certainly welcome, but it is very much their intention to have the devices capable of testing for other things besides COVID, because of course, in some sunny, bright future, maybe we won't have COVID and we're going to want to test for other things.
Mr. Chairman, one quick follow-up, if I may.
Certainly, Mrs. Haggard.
Thank you, sir. To get back real quickly before we lose you, is AstraZeneca the one that doesn't need a freezer? Have you heard that?
It's a different technology, and so the refrigeration requirements are different, and I believe not as intense as the cold chain that's required for the other two vaccines.
Thank you very much. Thank you, Mr. Chairman.
You're welcome. Mr. Perkins.
Thank you, Mr. Chairman. Dr. Williams, you showed that 88 tests per 24-hour period for the rayonics. The testing
Right.
sites, they're not open 24 hours a day, correct? Maybe 8-10 hours?
That's right.
Okay, so we're looking at high 20s, low 30s tests per machine per day, roughly.
Well, so the way, what happens at the collection sites right now is we collect all the specimens and then we send them off to the lab. So sometimes we're sending in a given day, we might put on an airplane 1,000 swabs. So the idea is, even though the collecting of the specimens is only done in an 8-hour period, actually running those specimens on the machine theoretically can happen 24 hours a day. So the machine is in the lab running tests, people are collecting the tests, but even when they're done collecting the tests, there's a whole pile of swabs that would be done throughout the night and early morning.
So that's the way it's being done right now with the machines you have. They're being done 24 hours a day.
That's right. And it's a little bit of a challenge because all these machines take certified lab technicians. So by the way, if anyone has a child or a kid who wants to go into a promising profession, become a lab technician, because they're in big demand right now. So the intention would be to run these machines, essentially 24 hours, 7 days a week, if we have the staffing to make that happen.
Okay, Mr. Lightfoot.
Doctor, some have said that because of the advent of and the ability to develop vaccines, that we really don't need these things. I don't say not at all, but not in any number. How do you respond to that?
Well, I think at the last meeting, I probably inadvertently described myself as partly an optimist. I'm partly an optimist and partly a cynic. I think even if the vaccines are as effective and as safe as they appear to be, there's going to be a unfortunately long period of time when we're trying to control the pandemic, and a long period of time in which testing is going to be critical. So, again, at some point, hopefully there'll be a bright, sunny future without COVID, but it's not going to be in December. It's not going to be in January. It would be lovely if it was sometime late in the spring, but the vaccine will be an important tool, but it's not a panacea, and it's not an immediate cure for the pandemic.
You have a follow-up, Mr. Lightfoot?
Just a follow-up, Doctor. Has the manufacturer of the rayonics machine provided their estimate of what the useful life of these machines is expected to be?
So I don't know that offhand. It's not something that we've asked them, and I don't know the information. I would say in general, lab instruments, for high complexity testing, it's certainly measured in years as a rule, if they're properly maintained, which they would be. But more detailed than that, I don't have.
Okay, thank you.
Mr. Denisha?
Thank you, Mr. Chairman. Dr. Williams, Mr. Boland, I guess for either one, with the tests that are sent out to the lab, you said 90%, and it takes at best 3 to 5 days, sometimes up to 10, to receive the results. But with the rayonics, if we can receive the test results within hours, it's reasonable to expect, I believe, that we could limit the potential exposure by a significant amount.
I think you mentioned a very important point about all this. So when we do testing and tell somebody, you have to sort of self-isolate for, 1 day, between 1 day and 10 days, it's very hard for people to do that. And I think we've seen again and again where in that period between when somebody was tested and when they get their positive result, there's quite a few exposures that can happen. So having a test that can come back, and I should also clarify, the test takes about 4 to 5 hours to run on the instrument. My lab director will be very angry with me if I tell you that you'll get it back within hours. What I would describe, I'd say this is a same day test. So if you were to get the test done in the morning, you'd have the result that afternoon, for instance. But that's a tremendous improvement over the 3 to 10 day test results that we're getting right now.
Great, thank you.
So we have Mr. Forsyth, then Mr. Smithers, then Ms. Curran, then Mr. Arquette. So Mr. Forsyth.
My question for Mr. Bowling. Dr. Williams mentioned running 24 hours. Do you have staffing and lab capacity? And do you intend to run for 24 hours with these machines?
Yeah, thank you for that question. So our lab already runs 24-hour operations. And this piece of equipment would be another one of many that we would expect our lab techs to run those tests.
Okay. The other question I have, how long has the Watertown been doing the rapid test? Anyone know how long that's been going on? That's the only local rapid test, right?
I believe there's one in Saranac, or I heard it on public radio today. There's one going somewhere in Franklin County, I believe.
Yeah. So, and the terminology is kind of confusing, but in terms of rheonics, so Adirondack Medical Center had one, and I believe they're installing their second one. So in terms of regional hospitals that are doing the same thing. In terms of rapid testing, keeping in mind that there's rapid antigen testing available and rapid molecular testing, which is called Abbott ID Now, that is available in both at some urgent cares. Some of the hospitals have limited supplies of these antigen tests. They're rapid, but they're inaccurate. So it's a trade-off. And what we're doing for the most part is if somebody has that rapid test, if they have symptoms and that rapid test is negative, we often are sending that PCR at the same time. So they sort of get 2 tests and they still have to wait for their PCR.
Okay. All right. Thank you.
Mr. Smithers.
My question was just asked.
That's asked, okay. Ms. Curran.
Hi. So each batch, Dr. Williams, this is a question for you. Each batch takes 4 to 5 hours to run. How many tests can you put in the cartridge in the machine?
I'm not 100% sure. I just know in my lab people looked at it. So the manufacturer says that you can run approximately 105 per 24 hours. Every person who actually runs a lab says, we can tell you we'll get you 88 in a 24-hour period, taking into account the cleaning and the maintenance that needs to happen between batches.
Okay. And then my second question, I guess, is can you do pooled samples for these, where you can do the pooled sampling with this machine? Because that would get you.
It's a question that we've put to the manufacturer, because pooled testing, increases the efficiency pretty dramatically. I've not seen that they're doing that, but it's a question that we have out to them.
Okay, thank you.
Mr. Arquette.
Thank you, Mr. Chairman. I think it's great news that the vaccinations are being moved forward, and hopefully that will be the end of this dilemma. But we're in our 10th, going on 11 months, and coming into this month, 410 cases, and now in the first 3 weeks, we've almost doubled those with more fatalities. That makes it very easy for me to support the purchase of these 2 machines and to allow the experts in the field to utilize them to their full capacity to try to in any way eliminate another single death or as many cases as possible. So For me, all of the information I've read, everything we've heard tonight, it's an easy decision for me to move forward with the purchase of the 2 machines. Thank you.
Anyone else? Well, Mr. Smithers.
I do have a question, but it's more for a county attorney or a county administrator.
I believe he's with us. Go ahead.
Regarding the legality of the county purchasing them, would they retain ownership of these machines? How does that carry forward legally? Can we buy them and then just lease them or let somebody else use them, or donate them, or how does that work?
Steve, did you hear the question?
I believe the question asked whether or not if we purchase them, the county is able to either engage in a lease of the machines to a private entity or provide. I will tell you there are significant restrictions within the law on a governmental entity gifting items that they have obtained utilizing taxpayer money. However, there are ways in which structured agreements can be made where if the county obtains assets that could be utilized by the private sector, under those agreements, they could utilize them if there was some type of exchange. Now, that exchange does not necessarily have to be monetary. That exchange could be for in-kind service. For example, if we had the utilization of the machines, but the individual private entity had the ability to run the machines, that might be deemed an appropriate exchange for value. Does that answer your question, Mr. Smithers?
Think so.
And also, I would
Lisa?
just add that there are other counties in New York State who have acquired these machines from Rheonics. I shared a copy of a lease with the county attorney to take a cursory look at that we could utilize a model that is being used well in other counties currently.
That answers
Okay, that answers Mr. Smithers' questions. We're back to Mr. Burke.
Oh, Mr. Reagan.
Go on. You're late, Jim. Go ahead, Mr. Burke.
I guess the question, as I listen to this discussion, how many of these machines do we ideally need? And you know, I guess I'm trying to see if we have kind of a plan to address this rising infection rate and what that plan looks like. And I wholeheartedly agree with what Tony said. You know, if purchasing 2 can help people get back to a normal life sooner, or it can alleviate contact tracing, and I don't know the full ramifications. Maybe you could touch upon that too, but I guess the question is how many of these do we need? And has there been a plan developed with our hospitals as to what they will purchase and what we will purchase, or what we could purchase, and is that sufficient?
So, I'll speak for at least for St. Lawrence Health System. So in recognition of the utility of these instruments, there's already a plan in place. As I mentioned, we already have 3, and there's already a plan in place to purchase more. If you look at the county and the needs for the county, certainly we could probably manage to have 15 instruments in the county, and that may or may not meet the need. So the St. Lawrence Health System is in the process of increasing their inventory of these devices already. I think if the county, purchased the additional devices for the county, I think that will be wonderful and helpful. But clearly, 2 instruments are not going to be sufficient.
And what are the ramifications of early testing?
Well, I think early accurate testing, again, it just improves our ability to control the spread of the virus. And certainly, I think as Dane has talked about, and as people have been aware, there's that time period between testing and results is critical. And anything that can shorten that period is very helpful.
Mr. Reagan.
Dr. Williams, what would your recommendation be to us as our advisor during this crisis?
Specifically concerning the Rionics?
Concerning, we've got a resolution because purchase 2 machines. Do you think we should do that?
Yes, I think it makes perfect sense, and I think it's an example of sort of a public-private partnership where the county and the local nonprofit hospitals can work together and help control the pandemic.
And it's my understanding one would go to Canton Potsdam and the other would go Claxton Hepburn. Is that correct?
That's my understanding.
Okay. Thank you.
Mrs. Haggard.
I don't know if this is a question for Dr. Williams, but I've been on a steep learning curve this week. It appears to me through some experience I had and some research I did that there's a direct correlation between economics, keeping people in their jobs, and the availability of testing where the results are back quickly. Is that your philosophy too? I mean, we have to also think of people working. We want to keep people in their jobs. And one thing that I've learned in my experience this week and through my research is that the key to maintaining the economy is the ability to test and get those results back quickly.
Yeah, I mean, so I agree with that statement, and I'll take it one step further. I think in general, the more effectively we control the pandemic, the better our economy does. So the more efficient we are, the more effective we are, the more we can control the spread of the virus, the more we can keep our businesses open, we can keep our religious organizations going. I mean, I think, to me, the goals of public health and the goals of community economics and community function are completely synchronous and parallel. I think with testing, there's no downside to getting a rapid, accurate test done. There's only upside.
Good. Anyone else? Jim Reagan.
I just want to say that during the pandemic, we've been very lucky to have Dr. Williams advising and sharing with us his expertise. And repeatedly, we've expressed our appreciation to him for taking the time and helping us through this crisis. And I think now that he is making a recommendation to us on how we can help provide a positive impact and help the people of the county as we enter what appears to be the most dire part of this entire crisis. I think now is the time for all of us to get behind what is really a fairly modest proposal that could help citizens stay healthy and help prevent the spread of this disease as we head into the worst possible time for the pandemic. Thank you.
So Jim, I don't know if you're coming across like a bullhorn. I don't know if you could turn your volume down, if that would have any. Is everybody on the Zoom, are you getting Jim Reagan at times 10 in volume like we are? Mr. Arquette?
I apologize.
Thank you, Kevin. I'm not sure if the technology permits or not, but if the St. Lawrence County Boardroom could mute while others are speaking. I don't know if that's possible because the number of you there, but that every time somebody within the boardroom makes the slightest of moves, it shuts off the speaker.
Okay. Yeah. Thank you for that, because I know, Mr. Perkins.
Thank you, Mr. Chair. I'd like to direct this to the county attorney. Steve, I wasn't clear on your answer to Mr. Smithers. In a short answer, is it legal for us to do this?
Yes.
Thank you.
Wow.
Okay, so to follow up on that question, while we're on that, would the expectation, Ruth Doyle, because the taxpayers are putting up the money, in theory, could be, if this resolution passes, putting up the money, would the expectation that services for our county employees would be, the cost would be zero? Or are we just going to move on like the general public?
The cost for county employees is currently zero and will remain so, regardless of the decision on this purchase.
So if we go and somebody takes a rapid test and we have a machine at Claxton will bill the county for that test?
They bill our insurance.
Okay. All right. Mrs. Haggard, did you have another question? You did. Please go ahead.
Yes, I don't want to get too far afield, Mr. Chairman, and I'm glad you're there and I'm here, because my next question is two enough?
Somehow I knew that was coming. So I would, Dr. Williams, your expectation is that St. Lawrence Health Systems is going to purchase approximately 12 machines, is that correct?
We're figuring out the number, but it's in that ballpark. So I think, to me, it's an important contribution from the county to be part of this, process. I don't want to speak for Claxton, but I think, it's an important contribution. Having the county, for instance, purchase 12 instruments would seem like a huge investment, and probably crossing a line. I think, purchasing 2, making sure that Ogdensburg has access and things like that, I think is reasonable. I'll just leave it at that.
And I would just
So
add to that.
Yes, go ahead, Mrs. Doyle.
Sure. There's a component to this that having the opportunity to place one with each hospital system allows us to exercise the process, if the board's agreeable, work through the order, receipt, implementation process. And as all of you are aware, I have to submit a pandemic plan in April of 2021. And this certainly would be a part focused on the COVID response. This would be a part of that. It doesn't necessarily mean that once we see these in place and their operations that I won't be back to you. That to begin with, I think it's reasonable, in Dr. Williams' words, to utilize one of each. They are not inexpensive, so this certainly isn't something that we undertake lightly. However, being able to work with each hospital system to also identify any obstacles. Some other counties are making community tests available to all residents. Some other options may come to light that I may bring to you. But I think starting out with one in each system gives us an opportunity to work carefully through this process. The experts are in the hospital systems, and certainly they can handle the volume. But from the county perspective, it allows us to work through this process, identify any challenges we may face, and come back to you with a report on how it's going. And also, if that includes the need for more, that we give you that option as well.
So Mrs. Doyle, in conversation or actually exchanging emails with you today, did you determine from your sources that 2 machines could be available by the middle of December if we got in line now?
So when you look at the calendar, at committee tonight, there would be a preliminary approval if the board would like to move forward. However, that won't be made official until December 7th at the full board. And some have asked about a special board meeting or things like that in order to accelerate the process. So in having conversations, our purchasing office was able to talk with the vendor, much like Mrs. Haggard did, and identify that should we be able to, following committee tonight, make the request to get in the queue, so to speak, that we could potentially see these in the middle of December.
Okay, so my concern as finance chair is that we place an order, the resolution passes, we place an order for 2 machines, but that we don't receive these machines until June. And that the viability of the machines, particularly with vaccines, potentially arriving by spring or throughout the course of the winter, that those machines not be obsolete, but that our crisis prevention would be minimized at that. And Dr. Williams, do you have an opinion on that, or can you have 3 machines now, I believe?
So what I can say is that one should always be skeptical. These are large purchases. It's a big deal compared to some of the other entities that we've dealt with regarding testing and reagents. So far, Reonics has held true. They, again, because they're regional and they have it's kind of a community orientation, everything they've said so far has been accurate in terms of anticipated delivery. They have very good customer service. They seem to be very conscientious about not overextending themselves and making sure that they understand the market. So I think if they're telling us they're going to deliver machines at a certain time frame, as far as I can tell, that's likely to be accurate.
Okay. Mr. Boline, Claxton Hepburn, you have not decided to purchase a machine on your own beforehand, before this conversation? Is it financially driven, or having the technicians available to operate this?
Yeah, so really neither of the above. As we've assembled our testing strategy thus far, then as I stated earlier, we already have machines. It's just been the rate limiting factor for us has been the reagents and the supplies, and that had been representative of our scan as we've looked for other solutions. So I'm personally excited if Reonics is able to deliver, then we would certainly consider the viability of not just one for the county, but taking a look at how we could continue to augment that.
Okay, thank you. Does anyone else have any other questions? No one here, no one on boards. Ms. Fiacco, do you have any questions? No, okay. All right, so that ends our discussion period. So let's introduce the resolution. The resolution is authorizing the purchase of 2 Reonic rapidly fully automated COVID-19 testing workstation and modifying it should say the 2020, not the 2021 budget. There's a mistake in the agenda. So the 2020 budget. So moved by Mr. Lightfoot, seconded by Mr. Forsythe and Mr.
Kevin?
Denisha. Yes.
Kevin, this is Kelly. We'll need to remove it from the table first.
Okay, so let's motion to remove from the table, Mr. Smithers, seconded by Mr. Denisha. All those in favor signify by saying aye.
Aye.
Opposed, motion carried. Now I'll reread the resolution authorizing the purchase of 2 Reonic rapidly fully automated COVID-19 testing workstations and modifying the 2020 budget. Moved by, again, Mr. Lightfoot, seconded by Mr. Forsythe, Mr. Denisha, Ms. Curran, Ms. Fiacco, Mr. Fay, Mr. Arquette, Ms. Haggard, Mr. Perkins, Mr. Sheridan, Mr. Reagan. I think it's everyone, practically. Discussion on the resolution. Ms. Haggard. Mrs. Haggard, I'm sorry.
That's okay. Mr. Chairman, I'd like to ask for a roll call vote on this, please.
Okay, when the time comes, we certainly can. Mr. Lightfoot.
I'd just like to say that, and I thank the members of the board for cooperating with this effort going forward. And I'm certain, based upon what I'm hearing tonight, that at the full board meeting, that this won't have any problem passing. I think what we're doing here tonight shows that there is a great deal of concern on the part of this board. There is a need and a desire on the part of this board to participate in providing some answers, providing some means to, as small as they are compared to the need, to do something to participate in driving this virus away, hopefully permanently, but at least in baby steps right now, getting rid of it. I think that purchasing 2 of these machines may be a first step. I hope that Hepburn and St. Lawrence Health Systems, once these things are in their labs and up and running, have an opportunity to look at the success of them. I'm hoping the success of them. And should the need arise, to consider, adding to their numbers, if that's justified. But I think in the first instance, the members of this board, and I congratulate you all for, and I thank you all for your support of this resolution. Thank you.
Mr. Arquette.
Thank you, Mr. Chairman. I echo everything that Chairman Lightfoot just said, and I'd like to thank our county administrator, Ruth Doyle, for doing the research and bringing this forward to us.
Anyone else like to speak? Mr. Sheridan.
Mr. Chairman, I think this purchase of the 2 rapid testing machines is critical in controlling the spread of this virus now and for the future. And if this purchase just saves 1 life, it'll be worth the investment. So I'm going to support the resolution.
Okay. Mrs. Haggard.
Thank you. And I just want to say how much I agree with what Mr. Lightfoot said. I heard from a lot of constituents. I don't know that I heard from constituents as much as I've been on this. So I feel very strongly, at least in my district, that we have a lot of community support for this. Thank you.
Mr. Forsyth.
When the resolution was first presented, I had issues with it, just logistics. I just didn't know the logistics of it. Actually, if someone brought an amendment to put 2, because I think 1 should be in Messina and 1 should be in Governor, but apparently St. Lawrence Health System is going to be doing that anyway. I'm hoping. But I'd probably support that too. We're to a point, this is taxpayers' money. We have a taxpayer issue right now. And I'll support it wholeheartedly. And if someone wanted 2 more, I'd probably go that. And then I'm clipping my conservative wings at that statement, but yeah.
All right, so we're getting ready to move on. If I was on the floor, I would be making a motion to amend this, that the delivery of the machines would have to take place before December 31st. I don't know if there's an appetite for that, but that's what I would be doing if I was on the floor, to assure that we weren't getting a machine in June. Mr. Perkins, do you have your hand up, or are you?
Yes, I do. Thank you, Mr. Chairman. This is for Dr. Williams or Mr. Boline. When you do these tests, when you get the samples and you decide which ones are getting sent out and which ones will be done rapid, is there a way to tell who's the most likely to have COVID? I don't know if there's a way to tell who's more likely or not, if those would be the ones going to the rapid test or not. I'm just thinking of saving on contact tracing.
Yeah, so it's a little complicated, but we do try and prioritize, based on somebody's presentation. So if they had symptoms that were characteristic of COVID, we would prioritize their testing. One factor also is sometimes people are already in quarantine and several days into quarantine and then become symptomatic. So although it's important for us to test them, the urgency of getting that result is not the same as the urgency of if we were to have a teacher or a bus driver who's newly symptomatic in quarantine. So it's a pretty complicated decision, but we work on that every day and make sure that we're appropriately prioritizing. I do want to also just mention Mr. Forsyth, I think, was asking about Governor and Messina. So our intention is to make sure that St. Lawrence Health System is 3 hospitals. We're looking at being able to deploy these instruments in each of the communities that we care for, and recognition of the importance of having testing available quickly to everybody.
Thank you.
Okay, so Dr. Williams, I want to thank you for sticking around and answering these very important questions. We appreciate your guidance. And Dr. Boline, I don't know if you're with us, or it's not doctor, but Mr. Boline, thank you for appearing before us and answering our questions and making us feel at ease that you have the technicians to run these machines, that they won't be in a cardboard box. So let's move. Thank you very much, Dana, for the work that you do, and thank you for your report. As always, I know your team is stretched to the limit, and the public appreciates, even though you may not, you only hear from the negatives, we appreciate what you do. So let's move on. All those in favor of the resolution, we're going to do a roll call vote. Ms. Kelly, on the resolution, please.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Nisha,
Yes.
Perkins, Akers,
Yes.
Bay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Marquette,
Yes.
Curran,
Yes.
Reagan, Reagan,
Yes.
Okay.
Forsythe,
Yes.
14 yes, 1 absent.
Okay, thank you very much, everyone. Okay, so we'll move on to the next resolution. Is modifying the 2021 budget for the Department of Highways and appropriating road machinery fund balance to the 2021 road machinery budget for the purchasing equipment. So moved by Mr. Denisha, second by Mr. Forsythe. Discussion on the amendment. Mr. Chambers, if you would, please.
Yes, thank you. This resolution that we're bringing forward tonight involves basically taking 2.5 million out of the equipment reserve fund. It's a fund that is fund balance that is resides within the Department of Highways for the very purpose of what this resolution is based on, to purchase equipment. In 2015, I submitted a plan to the Board of Legislators to purchase equipment in 2016, which was the phase 1 of the plan. This is phase 2 of the plan, which would be another large purchase of equipment, and which would basically leave us with a 5-year period of little to no equipment purchases in the department. Purchasing equipment in a large sum gives us more leverage in pricing, and also reduces our maintenance cost, and it keeps our as high as possible. This plan will provide us with a more mobile and agile group of equipment to help maximize our dwindling numbers that we have at the Department of Highways. So I see it as a critical piece in continuing to supply the services that we supply to the county.
Okay, Mr. Forsythe.
Don, I know in some of the other industries right now, like lumber and things like that, are sky high. How's machinery? Is it staying level, is it going down, or is it going way up?
From what I've been told, the equipment is one of the reasons we want to get out before the, get a letter of intent out to the manufacturers before the start of the year, is they're anticipating some increases in equipment costs as well. So getting out before and doing the letter of intent in the month of December of an order would certainly help keep the cost of the equipment down. I've been assured that there will be increases.
Okay, thank you.
Anyone else? Don, after we, if this motion, a resolution is approved and we authorize the 2.5 million out of the fund balance, what remains in that highway fund? What's the balance?
Well, there will, I don't know the exact balance. but it will be down to quite a low amount. But there is also another reserve in the highway road that is in the around $3 million, I believe, in that fund.
Okay, so we won't short ourselves if we do have an emergency and will our plans move ahead on these salt buildings?
That is
Is that
something that is another discussion for another day, I guess.
Okay.
We do have plans that we have progressed to along quite a bit, but I think needs further discussion with the board and the county administrator.
Okay, thank you. Any other questions, Mr. Chambers, concerning this resolution? Seeing none, all those in favor of the resolution, please signify by saying aye.
Aye.
Anybody in opposition? Motion carries.
Thank you.
Okay. Our next resolution concerning the highway is approving a supplemental agreement number 2 and authorizing the chair to sign a contract with Stantec Consulting Services, Inc. for construction inspection service for Browns Bridge Road over the Racket River project. Bid number 322-1560, bid number 775380. Moved by Mr. Sheridan, seconded by Mr. Lightfoot and Mr. Smithers. Discussion, Mr. Chambers.
Yes, this project on Browns Bridge was approved last month for the construction. Under the guidelines from the federal and state government, we have to provide 100% coverage for construction inspection. And the plan would be to utilize at least one staff member from the department staff, basically to be on site, as well as the consulting firm to supplement our forces. This is 95% federal funded and 5% county.
Thank you. Any questions? Mr. Perkins.
Thank you, Mr. Chairman. I'll be abstaining due to my employment.
Thank you, Mr. Perkins. Anyone else? Seeing no more questions, all those in favor of the resolution, please signify by saying aye.
Aye.
Opposed, motion carried with Mr. Perkins abstaining.
Thank you.
Thank you. The third resolution is modifying the 2020 budget for solid waste department for higher than anticipated expenses. Moved by Mr. Perkins, second by Mr. Sheridan. Mr. Chambers.
Yes, I think as the board is well aware, the recycling market has evaporated, and the arrangement that was going to be for a recycling center in Harrisville did not materialize. It is now just basically a transfer station. So the county has, instead of in the 2020 budget, we anticipated that we would not have recycling fees. However, we did leave quite a number of dollars available in contingency in case this problem did arise. So what we're asking for is to take money out of the operating budget. This is not out of a savings count. This is out of the operating budget, the contingency line, largely to do with recycling. The recycling materials are now being transported to Dank in Harrisville, where Dank is then transporting them to Recycle America in Liverpool, New York. And the costs are, and the county is paying the recycling cost at that location, which have been well over $100 to around $80. It fluctuates on a monthly basis, but this should take us through to the end of the year within the budget.
Okay, any questions for Mr. Chambers? Mr. Chambers, can you explain the $60,000 on the tip fees? You anticipate an increase for the public on the tipping fees on recycling items?
Yes, sir. Yes, that was due to the increased flow, in part to the increased flow from Casella. The county agreed on leasing trailers from Casella to transport the recyclables from their facility to Harrisville, rather than bringing them to county facilities, unloading them, and then reloading them again just to transport them to Harrisville. So that in part is the increased fee that Casella is paying the county.
Okay, so it's a reflection of the revenue from that hauling for
Yes, sir.
Casella. Okay,
A
thank
portion
you.
of it.
A portion, okay. Any other questions for Mr. Chambers? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried.
Thank
Thank
you.
you, Mr. Chambers.
Thank you.
Next resolution is elections, real property, and community college apportionments for the year 2021. Moved by Ms. Curran, second by Mr. Forsyth and Mr. Arquette. Mr. Green.
Yes, good evening. This is a yearly resolution brought forth to you that shows what the three chargeback charges would be on the 2021 town and county tax bill. Consist of the election charges, real property, and community college. These are charges from really the 2019 year coming forth. And they show, in the case of the Board of Elections, direct expenses and indirect expenses involved. I will point out that the totals here are down about $61,000 from last year, so about a 2.8% savings.
Okay, any questions for Mr. Green from the legislators? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Thank you, Mr. Green. Next resolution is authorizing the chair to convey the car site located at 97 Main Street of Herman to the town of Herman. Moved by Mr. Denisha, second by Mr. Forsyth and Ms. Curran. Discussion. I guess we have our county attorney online, right? Mr. Button, are you with us? There you are. Okay.
I apologize. Took me a little while to get things firing up. The resolution you have before you would authorize the conveyance of a piece of property that has been remediated as part of the agreement with the oil spill fund in the town of Herman. As I think that you're all aware, the town of Herman has made a request to obtain this property for safety concerns that they have communicated to the county with respect to the approach to one of the oldest stone arch bridges in New York State. It is my understanding that it may even be the oldest in upstate New York. The exchange would be with respect to the amount of the base taxes that are due and owing, which are currently close to about $10,000. As I think you're all also aware, following the exchange and the sale, the $10,000 or approximately $10,000 would be split, with half going to the oil spill fund to make them whole on the agreement for the remediation at the site.
Okay, any questions for our county attorney? Okay, Mr. Perkins.
Thank you, Mr. Chairman. Steve, what is the safety hazard that you say in the approach?
Thank you for asking. It's my understanding that A, the lot is non-conforming. B, the lot is contiguous to the stone arch itself. And there is a roundabout, I don't want to call it a roundabout because that gives a wrong perspective. There is a hard turn into the village on the approach towards the bridge that the utilization of this land would now permit them to essentially funnel the traffic in a way that would make it safer than it currently is. In fact, when we had pre-committee, Mr. Chambers was kind enough to describe the approach a lot better than I probably can, and I don't know if Mr. Chambers is on, but he may be able to fill it in a little bit better. I will note that at the time that this stone arch bridge was constructed, it was primarily horse and buggy travel. Now that they're utilizing it, I believe Mr. Chambers suggested that upon the funneling that there may even possibly be a weight reduction on the utilization of that bridge, so as not to continue to damage it. I do think that it is important not only for ingress and egress, but I do believe that it's important to the town for its historic nature.
I wouldn't normally support this without the total taxes, penalties, and interest, but because of the safety issue, I will be supporting this.
Thank you.
Okay, I'd like to ask Mr. Denisha to speak to this. I know he's chomping at the bit here. This is his home ground, his stomping ground. Mr. Denisha.
Yeah, thank you, Mr. Chairman. For those of you that are not familiar with the bridge, as Mr. Button pointed out, the bridge was built, well over 100 years ago, and it was designed for the traffic at the time. And the turning radius is going to, the turning radius that's needed with some of the new equipment is much greater than the original design. And with the access, with this old service station gone, it's going to allow a greater radius for turning onto the bridge, greater radius for people exiting the bridge. It's just going to enhance the safety of folks that are coming up County Road 17 into the hamlet of Herman, or coming across the bridge and taking 17 toward DeKalb Junction.
And Mr. Denisha, in the town of Herman is willing to pay the $9,710. Is that correct?
Yes, I have spoken with Michael Perry, who is the town supervisor. Spoken with the board members, and they are in total agreement. And as a matter of fact, they're very happy that they're very happy that the work was done. That the county is willing to do this.
Mr.
So
Akers, if I may
Yes,
add something also, given the safety concerns, the oil spill fund was willing to modify their agreement, which normally requires us to send the properties that we do a cleanup on to an auction, concluding with the split coming from the auction. The oil spill fund was willing to amend our agreement to permit this type of transfer directly to the town of Herman at this point.
So let me ask you this, Mr. Bond, if indeed this resolution passes, any construction or highway construction, because that's a town road coming into a county road, to help make that left turn possible for those coming over the hill, who would be, maybe Mr. Denisha can answer that. Who
It's
would,
not a county, the county road, County Road 17, that,
oh, it ends before there?
it ends prior to that.
Okay.
So that is all town, it was village road, the village dissolved, so it's all town road. There are no intersecting county roads there at all.
Okay.
I was just about to comment, but Mr. Chambers, once again, the wealth of knowledge that he is during pre-committee, was willing to share with us the fact that the county highway actually ceases prior to the bridge connection. In fact, right there, essentially. So we're not going to have to worry about assuming the responsibility for any modifications to the roadway there as a part of the county structure.
Okay, thank you. Any other questions on this resolution? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Let's see. Our next presenter is our treasurer, Renee Cole, and the resolution is charging tax items.
Hi, thank you.
Moved by Mr. Sheridan, second by Mr. Forsythe and Mr. Lightfoot and Ms. Curran. Okay, Mrs. Cole.
Thank you. This is an annual resolution presented at this time of year in order to put these items on the upcoming tax levy. It represents amounts due to towns for tax refunds, cancellation of taxes, and assessment errors.
Any questions for Mrs. Cole? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Our next resolution is adopting the mortgage tax report. Moved by Mr. Forsythe, seconded by Ms. Curran. Mrs. Cole.
Thanks. So this is a semi-annual resolution that allows the treasurer's office to distribute monies collected by the county clerk that are due to the towns and villages. The county clerk funds over to my office monthly, and twice per year, the county clerk submits a report to the state for approval. Upon approval from the state, we submit a resolution for your adoption, and this amount represents the April through September 2020 timeframe.
Okay, Mr. Forsythe.
Renee, this amount seems lower than normal, is it?
So I have the last 2 years with me. 2018 was 504,000 and some change. 2019 was 555,000. So right in the middle.
Okay, all right.
Okay, any questions for Renee? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Thank you, everyone. Next up is our county administrator's report with Ruth Doyle. And the resolution is authorizing the chair to sign a contract with Compliancy Group LLC for the purpose of consultation services and maintaining a repository for the HIPAA HIPAA compliance. Moved by Mr. Perkins, second by Ms. Curran and Mr. Smithers. Mrs. Doyle.
Good evening, everyone. I have joined in the boardroom. As I understand, last week it was pretty difficult with some of the feedback to hear me. So this first resolution is for the Compliancy Group. This was an endeavor that began with the district funds. If you recall, the work that Community Services did to introduce for about 5 years different behavioral health advantages to the region. Funds were used at that time through NCI, and this last year was the last year of district funding. So this moves over to a county cost, and the Compliancy Group has already put into place, working with my assistant administrator and the departments impacted, to be the repository for the training. So should we be audited, we can demonstrate that these trainings have taken place, as well as provide and give us a heads up when there are new changes to any of the regulations provided through OMH, OASIS, or Department of Health. Questions?
Any questions for Mrs. Doyle? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Our next resolution is authorizing the chair to sign a lease agreement for space at 21 Harrogate Commons, Messina, New York. Moved by Mr. Forsythe, second by Mr. Perkins. And Ms. Curran. Mrs. Doyle.
So we have the facility that was constructed for the county. For those of you who may remember, some time ago, prior to 2010, we were located in a rental facility on the other side of Messina. This building was constructed to our specs and to fit our needs. That lease has now expired. We do have great partners in our landlords of Harrogate Commons, and we're looking to put a lease in place, both to, if you recall, we have placed the backup 911 center in Messina. We are currently putting in a generator there, and we have our services provided by the DMV as a reason the resolution, probation, and community services as well.
Any questions for Mrs. Doyle? Seeing none, all those in favor of the resolution signify by saying aye.
Aye. Aye.
Opposed, motion carried. Our next resolution is establishing a date and a time for the organizational board meeting. Moved by Mr. Smithers, second by Mr. Lightfoot.
So as luck would have it, not many things have been lucky in 2020, but in 2021, our organizational board meeting falls on a Monday. And as many of you will recall, this is pretty rare, as the first organizational meeting of the Board of Legislators annually happens on the first business day of the year. So Friday, as you all know, is New Year's Day, then the weekend, and then we will conduct our meeting that evening at 6 o'clock. What you will see next month is our schedule associated with the rules of procedure. So we'll bring that to you to talk about the committee schedule, whether we're going to combine meetings next year, and how all of that will be handled. So we'll bring that to you, especially for those who haven't been through this process yet. We'll bring you a tentative schedule, at Finance in December to follow along with this organizational meeting that you'll approve with the rules of procedure in January.
Okay, any questions? All those in favor signify by saying aye.
Aye.
Opposed, motion carried. Our next resolution is declaring October as the first St. Lawrence County History Month. Moved by Mr. Denisha, second by Mr. Smithers.
So we are fortunate this evening to be joined by our interim historian, Nancy LaFavor. She's there, if you can see her there. We are excited, while it seems far away, to bring to you the first designation of St. Lawrence County History Month. Nancy?
Well, it came to my attention that there's a National Archives Month in October. And previous to 2019, there was a New York State History Month, which was November, but then last year, Governor Cuomo changed it to October. So I thought it would be a really neat thing to do, to join all of our historians together, as well as the county, and declare October St. Lawrence County History Month, and see if we couldn't do some things to kind of promote our county and all the work that the local historians do at each of their levels, but also collectively.
So I attended the annual meeting of the historians, which was organized and facilitated by Nancy, and the group took a vote. They discussed, we discussed everything from staying with November to looking at March, which was the county's, organized in March. And the group decided they wanted to follow along with October. So there was a vote of the historians that were on that call, and so that's what you have before you today.
Okay. Any questions or comments concerning the resolution? I must say that I enjoyed reading the last handout of the Historical Association, and it talked about the hermits, the aristocracy, the shysters and the con men and the dynamic women that we had here in St. Lawrence County back then as we do here today. It was quite interesting that I didn't realize that I think General Sheridan and General Grant had actually visited Ogdensburg at one point in time. It was quite interesting. The other thing that I noticed was that many of the authors were people who resided outside of St. Lawrence County, but had some connection, whether they were given a book by a grandfather or something like that that piqued their interest. The closest thing we have is Jim Reagan on their legislative board, who's a historian. And so it was really interesting. I really enjoyed it.
Great.
So concerning the resolution, all those in favor of the resolution signify by saying aye.
Aye.
Opposed, motion carried. Keep up the good work.
And Nancy, did you want to mention one other thing?
I do, if I have just another minute.
Certainly.
Well, as you can see, I'm still here at school in Heuvelton, and we have a gentleman in Heuvelton who will be turning 100 years old on December 22nd. He's a World War II veteran, Doug White, and I didn't know if maybe there was something that the county could do to recognize him. I know letters have been sent to, the president and Senator Ritchie and all sorts of other people. The town is giving him a plaque. All the kids here at school, I've got them organized and making birthday cards and that sort of thing. So I didn't know if there was something maybe the county could do at the county level to recognize him.
We can talk about that.
You want to mention anything, Ruth? You said we can talk about it.
Yeah, Nancy, I'll give you a call on that. I just wanted to share. I think that's pretty remarkable.
Okay.
And certainly can bring something to you. His birthday is what, December 22nd, you said, Nancy?
Correct.
Okay.
Okay, well, thank you very much, Nancy.
You're welcome. Thank you.
Okay. Our next resolution is modifying the 2020 budget for the Historical Association for Web Development to provide access to archives for the public. Moved by Mr. Forsythe, second by Mr. Denisha and Ms. Curran.
So the modification being requested for consideration tonight, if you go back to our 2020 budget, I set aside funds for two purposes in contingency. One was for the Historical Association and the other was for reforestation. And for a variety of reasons, mostly involving COVID, those have taken either much longer into the year or not going to happen this year. So joining us tonight is Ashley Moretti and Lenore Zanier, both from the Historical Association. Ashley is our new executive director. So I wanted them to speak to the way that they would like to see if the board will consider utilizing these funds to big step forward with technology. Good evening, Ashley. Good evening, Lenore.
Good evening. Hi, everyone.
Hi.
Can you hear me? Yep.
Yep. Who would like to go first?
I'll say a few words. My name is Ashley Moretti. I've been the executive director for the Historical Association for it'll be 4 weeks tomorrow since I started my position. I'm absolutely delighted to be here, and I'm honestly astonished at how many historical resources that St. Lawrence County has. And right now they're in our research room, they're in our archives, and they're not out there for people to discover. I feel like this is such a great untapped resource, and us getting this extra bit of funding would make huge strides for the museum, for the Historical Association, and indeed for St. Lawrence County in general. This county has reach all over the world. It's entirely possible that someone halfway around the world is interested in researching their family's genealogy that has roots in St. Lawrence County, and they could come to us via that technology. And right now during the pandemic, this is the best time to do it. This is how museums are increasing their reach in the pandemic.
Okay. Lenore, would you like to make some comments?
Sure. I'd just like to introduce myself, Lenore Zonier. I'm on the Board of Trustees of St. Lawrence County Historical Association, and I chair the Ad Hoc Technology Committee. And I joined about a year ago, and when I got there, even though I've had a 25-year history with the association doing research myself, and I'm also the Herman historian, I noticed a real lack on the website and an inability to add new things, reach out to a broader audience, and be able to put digitized documents and historical documents up on the website. We have a wonderful archives of county records, and we had a volunteer that has built that website 20 years ago, and it hasn't been updated since. So in order to remain a viable repository for our wonderful local history, we need to be more responsive to the technology of today. And certainly with the health issues that we've seen and the educational needs of teachers that are looking for resources to connect their online teachers, teaching strategies, we can offer a wonderful platform for that. I've done, with my technology committee, we've investigated what are the kinds of things that we can do, and I have spoken with a variety of vendors that know how to do this, and I've looked at the websites that they have built, and I'm confident that for this amount of money and also to build our digitization ability, we can really come in the next year or 8 months, we can really come back into the 2020s and 2021s and be able to touch base with a broader audience and also service people locally, like teachers, and attract tourists and attract people to come and visit. As a historian, I have answered numerous questions about genealogical questions, and they would love to come here to the association. Right now they can't, but if we can put a more indexed database up so they see what we have, and we can possibly even monetize it in a way so that somehow we can keep that base encouraged to come, and when we get all healthy a little bit better, they will come to St. Lawrence County and check out our association, our museum, our wonderful resources, as well as vacation up here. One of the important points of this is the digitization of these documents. We have personally, my husband and I actually have been doing this for 20 years. And if you look at the slcha.org right now, you'll see a wonderful exhibit of textile tools and weaving textile tools and weaving spinning wheels and of Carlton Stickney. And that exhibit was recognized, and he was recognized because it was out on the web. So we can't hide our light under a barrel. We have some wonderful people, some wonderful people who can contribute. I'm looking forward to having Ashley do a lot of podcasts, webinars, lectures, all kinds of things that we can reach out to the public, and in addition to the wonderful archives that we could digitize. Part of the money, part of the funding that we're asking for would go to a high quality camera, which makes two wonderful files. One is an archived one that can be archived. It's a very large file, high quality, and you can just zoom into it and see the best detail of maps, which we've done. You see a map behind me that we've done. You can't see it too well right here. If I had more time, I'd show you some things, but we have digitized handwritten Board of Supervisor minutes from 1832 that is nowhere else to be found. The uniqueness of what St. Lawrence County Records and Archives has to offer cannot be compared with anything that you'll find on Ancestry or MyHeritage or any of those things. So that gives us that special place on the web and connecting with the outside world in an attractive way and effective way. So
Well, thank you very much, Lenore. Does anyone have any comment that they'd like to make to Lenore? And welcome, Ashley. 4 weeks in the North Country. You've survived so far. You got your first snow. So I think Jim.
I moved from Syracuse, so snow I'm well acquainted with.
Oh, you'll have sunshine up here. Syracuse, you don't get any sun.
Right.
I think Jim Reagan had his hand up first. He'd like to make a comment, and then Mr. Denisha. You may.
I had the opportunity of meeting Ashley the other day, and I certainly want to thank the Historical Association for honoring Mr. Stickley. I had the privilege of him taking me on a personal tour of his current exhibit at the association. And I would urge everyone to stop by and see what they're doing over there. But I think that I would also want to urge everyone to support this resolution, because it's very hard for people to understand just how valuable having access on the web to all these historical treasures that are in our archive. And really don't want so many people handling them. If we can put them, computerize them, digitize them, and make them available to a far wider audience. And it really does work at attracting people to come up here. We've been seeing over here in Ogdensburg, I've had countless people come and stay at my inn who found the Remington Museum on the web and saw some of their exhibits and decided to come to Ogdensburg from Vermont, from Massachusetts, and elsewhere to see what's available. And we really have some remarkable treasures in the St. Lawrence County Historical Association's facilities. And this is a way to make them available on a much wider basis. So please consider supporting this.
Okay, thank you. Mr. Denisha.
I'll keep it short. I've never met Ashley before, but I know Lenore and Roger. They are, Lenore, I'm familiar with her work and her husband Roger's work in the town of Herman. And they've done a great job. And actually, when we were talking about the bridge in Herman, Lenore knows a lot more about the McBriar Bridge than I suspect anyone else in St. Lawrence County. But I think this is money well spent. I'm familiar with Lenore's work. And I think it's money well spent. We need to move ahead.
Okay, so
May I say
Mrs.
one
Haggard. Okay, I have Mrs. Haggard before you, Lenore, and then we'll get you a chance there. Go ahead. Mrs. Haggard.
Thank you, Mr. Chairman. I recently inherited a huge amount of genealogical information. And I can tell you that this is so important and so helpful because prior to, I'd say, even 10 years ago, so much was not available online. So I have massive quantities of paper, and this is hugely helpful. And I'm looking forward to using it in my quest. Thank you.
Thank you. Lenore, if you'd like to make some closing comments.
I would like to say that I'm excited to hear about the October New York State History Month, and that we will align that in St. Lawrence County. And I think that Nancy and we could do some fantastic activities together and have all the historians from St. Lawrence County contribute perhaps something monthly, little tidbits of something that's interesting that people can go to and would make them come back. And I've looked at that at other websites, and it's very attractive. People love to just come back and see what's new. And each historian could contribute something and work up to next year, and then have a nice database and a beautiful bank of little tidbits from each town. So I'm happy to offer that and work with Nancy on that.
Thank you, Lenore. So as to the resolution, seeing that there aren't any more questions, all those in favor of the resolution, please signify by saying aye.
Aye.
Opposed? Motion carried.
Thank you, Ashley. Thank you, Lenore.
Thank you.
See you soon.
Thank you.
So our next resolution is authorizing the creation of a reserve for the 2020 appropriations for the Bassmaster Tournament. Moved by Mr. Arquette, second by Ms. Curran, and Mr. Smithers, and Mr. Lightfoot.
So this resolution I mentioned to you last week, and certainly through the budget process, a number of you asked about setting this money aside. I think that while much of 2021 is unknown, one of the things that the board could consider is setting these funds aside so that there doesn't have to be the discussion and or the uncertainty for the folks who work on Bassmasters to make sure that the, I believe, second to last year of the current contract will be honored financially. So these would be payable much like you did recently with the Fort Law presentation. Those were set aside and able to be available upon the request being made to me at the county.
Okay. Any questions for Mrs. Doyle concerning this resolution? Seeing none, all those in favor of the resolution signify by saying aye.
Aye.
Opposed? Motion carried.
Just a few other update items before we go to committee reports. On the COVID update internally to the county, you're familiar, I shared with the board on the weekend that we have made a determination to maintain the Harold B. Smith building closed through the working days this week for the office staff. So that will be Monday, Tuesday, and Wednesday. There has been a deep clean and disinfectant provided to the entire building. We started with one unit, but as we worked through the information available, it became clear that that was our best decision to move through the entire building. And there are staff currently in quarantine, and we're planning that reopening of the building to staff will be Monday, November 30th. So all services continue to be provided. All staff are working remotely. And we've also been able to give an alternative work location to some staff at the Human Services Center conference room. So I think we've been able to adapt. Certainly give great kudos to all of our employees who are making it work out in the field, and those who stood by guard at the building to make sure no one's needs went unattended. While they were not asked, they made sure that the people they serve did not go without. So I certainly am very proud of our staff and their ability to respond in this situation. This past weekend, our totals were shared. The isolation and the testing numbers were not updated, but I'm hopeful that at least providing the new positives as well as the hospitalizations is helpful. Our transit update. So we've been upping our conversations with transit to each week. As you will recall, there were 2 initial routes that were impacted by positive cases. A third was added. And while this week we moved back from a 2-week suspension of those routes to a modified version so that we can carefully monitor to make sure there are no additional cases. So we're watching this very closely. Our staff in planning and also at ETC, Frank Bildo, our mobility manager, are watching this closely and keeping us well informed. Over the next 5 weeks, we want to focus on those 5 pillars with some special attention to each one each week. So we're looking at, of course, how we employ all 5 pillars at all times, but we're going to look at sanitization and washing of your hands this week. Being that this is a big meal week, and understanding how people are refocusing their plans, you'll be hearing a lot more about hand sanitization this week. And next week, the masks that have been ordered, that we held the contest earlier in the fall, you remember, they have arrived, and we're organizing distribution at each of the school districts. And that will begin next week, when our focus on mask wearing as a pillar will be the focus for that week. Today, we held a flu clinic for 21 of our employees that were vaccinated. Approximately 130 have been vaccinated so far. If you recall, Public Health provided a very handy drive-through clinic prior to the spike in cases. And now we're partnering with Kitty Drugs, who's provided us with a pharmacist to make those vaccinations an additional option. So we're grateful for that. And we're also going to work to schedule another date for employees as well. As a reminder, we're closed for the office staff Thursday and Friday this week, but there are certainly many services in the county that go 24/7, 365. So we're certainly grateful for those services to continue. Next Monday, we will have no meeting, and that will bring us to Monday, December 7th, which is when the memorial ceremony will be held. And we're working to modify the ways that we traditionally honor, we can no longer do as a result of COVID. So for those of you who haven't been with us, what we normally would do is provide each of the legislators with a flower that they would share for each of those we have lost on an annual basis. They would offer words of condolence and or be able to shake hands and in some instances, give the family members a hug. So since we can't do that in the situation that we're in now, we're thinking of new ways that we can make it special for those people that we've lost who provided county service as a legislator over the years. Along those same lines, we're trying to redefine how we celebrate the holidays in the county. It's very likely that we'll remain at 50% in-office staff, and we're attempting to get creative with safe ways to celebrate. There's so many to thank and so many to show our appreciation to this year. While sharing meals and getting together are not good options, we'll certainly find others and certainly employ the employee recognition program as a part of that as well. Any questions?
Mr. Denisha.
Thank you, Chairman. Ruth, have there been any discussion, given the severe uptick in cases, has there been any discussion or do you expect to have any discussions regarding reopening the emergency operations?
We have been having conversations about that, I want to say, for about 2 weeks now. Currently, we have opened, and we will be staffing a public health call center, a COVID call center, which will provide an opportunity for phones to be answered. But currently, if you recall, early on in the EOC's operations, we were able to distribute a large amount of PPE. We don't have that option at this time. We do have, and had staff at that time, planning who would update the maps. It was an alternative phone answering opportunity for folks. We also had a deputy and a state police officer. So one of the late additions we made to the Emergency Operations Center was mental health, and we also were able to have someone assist us that way. What we're looking at is the relevance in terms of our ability to respond. So we're currently continuing to look at that. We're going to work on the call center this week, and as we watch those numbers continue to rise, we'll be looking at whether that should be reopened.
Thank you.
Okay, Mr. Burke. Just want to, Lenore took most of your time, Mr. Burke, but you'll have to be brief.
Oh, yeah?
Just kidding. Go ahead.
Ruth, I just wanted to know about our contact tracing. Do we record, do we measure how we're doing with contact tracing? You know, the discussion tonight about the rapid testing was very enlightening and certainly gratifying, but the contact tracing is really a critical piece. And I guess I'm just wondering how we're doing, with the surge coming on. And I guess the other question, maybe you touched on this, and that's personal protective equipment. You don't have to look at the TV very long to know that the whole nation is responding to this surge. I guess in essence, what I'm asking is what is our state of readiness and how are we measuring it? And are we doing okay with contact tracing? Because that is much like the rapid test. It's one of the cornerstones for addressing this pandemic.
Sure. So a couple of things. The contact tracing is of great importance, but that doesn't come without accurate case investigating happening prior to. So one of the areas that we're strengthening right now is our case investigators. That helps gain the information that can then be entered for contact tracing to occur. And we are on a daily, if not daily, definitely weekly, adding numbers to those contact tracers. That also is a cumbersome process in getting the training prepared. So there's a 5-hour course Johns Hopkins offers, which is online. There is about an hour and a half training that happens with our public health staff. And then there's a couple of training on the job, so to speak, training, where you sit with a contact tracer and you hear, and they sit with you and they hear those conversations to make sure there's an adept conversation occurring with the right guidance being provided. So we're currently training a number more of contact tracers that will be of assistance. What we don't want to do is overwhelm the ability for the case investigators and the public health staff, who certainly have the expertise on this, to be able to handle the contact tracers that we have. So as I'm told, and I spoke with Dana this afternoon, we are doing okay with contact tracers. What we're going to be ramping up over the next 2 weeks precipitously is our case investigators. And she also tells me that we are not terribly different in terms of the turnaround time than we've been at any given time during the response. While there may be more, we also have the state assistance that's been provided, you may recall, for the travelers at one point, and now they're also assisting on some of the contacts as well. So I think our state of readiness at this point in time is able to respond. I think answering the phone for folks receiving those contact tracing calls, getting that accurate information provided when the case investigation occurs, those are all key points to being able to do it accurately. And I think that we do have some personnel, as we've reduced our in-office staff, who are also transitioning from county staff over to be able to help. So I think we can find as many as we need in terms of contact tracing. So it's a situation where we bring some contact tracers forward, get them trained and off and running, and then we need to train more. It's a volume issue.
Well, and the volume is, as we can see, is definitely increasing. And I guess, again, I'm wondering if there aren't some metrics that would give us a little more insight into our state of preparedness.
Sure, and I can bring some of those to the board meeting to you, John. I can give you some numbers associated with where we started with contact tracing, where we are now. And if there's a way through the eClares system to do turnaround time, those kinds of things, we can look at that and see what kind of data we can pull for you.
Thank you, Ruth.
Sure.
Well, one of the things that's encouraging, John, is that our hospitalization rate is using about 25% of the capacity. We have about 40 rooms, 25% would be about 10. We have 11, so we haven't reached any critical stage, but I think with the testing that we approved tonight, that could help that keep that number lower or as low. But fortunately, our death rate is pretty darn low. It's like 0.001%. So,
any other questions?
Do you have any questions for Mrs. Doyle? Okay, we'll move on to committee reports. Our first up is Cornell Cooperative Extension. We have Mr. Denisha.
Mr. Chairman, we have not met since October 22nd. Their organizational meetings are reported at the last Finance Committee meeting, so I have nothing to report.
Thank you, Mr. Denisha. Fish and Wildlife Management Board for Region 6, Ms. Curran.
We have not met since the last time that we talked.
Okay, thank you. Fisheries Advisory Board, Suzanne Fiacco, did Ms. Terminelli give you a report to pass on to us? She did not, okay, thank you. Okay. Governor Fair Board?
Nothing new. They have no meetings planned through the holidays. Next meeting is scheduled for February 9th.
Thank you, Mr. Smithers. Highway and Solid Waste Committee, Mr. Sheridan.
Mr. Chairman, no report at this time.
Thank you. IDA, Mr. Reagan.
No report at this time.
Thank you. Recreation and Trails Advisory Board, Mr. Arquette.
Thank you, Mr. Chairman. Deb and the group of volunteers have done a great job repairing the trails, bringing the maintenance to the level of us now praying for snow. Thank you.
Okay, thank you, Mr. Arquette. St. Lawrence River Valley Redevelopment Agency, or the RVRDA, Mr. Forsyth.
No report, we haven't met.
Okay. St. Lawrence County Chamber of Commerce, Mrs. Haggard.
Yes, I do have a few things, Mr. Chairman. First of all, the visitor relocation guides have been printed and Brooke will be dropping those off at the county building, hopefully this week. We're well aware of the chamber's reorganization. We talked about that before. Promotion for snowmobiling is in full swing and people are starting to plan those trips. And also there's a big push, and I would say we all could benefit from everyone shopping local for the holidays. Our next meeting is Thursday, December 10th. Thank you.
Thank you, Mrs. Haggard. Soil and Water Conservation District Board Directors, Mr. Burke.
Kevin, I wasn't able to make the last meeting. Would you mind giving the report?
Certainly. It was routine approval of the treasury reports that the ash board reporting that our forester has done, Aaron Behringer, has actually received the award. I think it came out of Franklin County, and I think it was North Country Public Radio. I missed it, but just end of the year, getting things ready for the 2021. We did like 217 acres of putting ryegrass down for erosion control and putting nutrients back into the soil on farms that we do cost sharing, I should say. Okay, so we're next on to the old and new business. Does anyone have any old business? Mrs. Haggard.
Thank you, Mr. Chairman. I wanted to know where we were as far as the DANK proposal. I've had a lot of emails and feedback from people, not just my constituents, people that know me, wanting to.
I'm sorry,
Okay.
that resolution will be, it's on the table and it will appear on the next Monday, right, Mr. Lightfoot, on the board meeting. You'll have to be taken off the table and revisit it.
Okay, I couldn't remember when we moved it to. So do we have a meeting next Monday?
2 weeks. 2 weeks. It's actually 2 weeks from now.
Yes.
Okay, so, okay, great. Thank you very much.
Okay. So Mrs. Terminelli has joined us. We did ask Suzanne Fiacco about the Fish's Advisory Board. She had no answer. You did not issue your report. Do you have a report?
I gave her my report to give. I did not. We have not.
Susan, we have a problem, Susan.
No,
she sent it to someone else.
Okay. All right. Well, thank you for joining us. Any other old business? Okay. How about new business? Well, this is a first. Okay. So Ruth, for executive session, do we need all three: negotiations, litigation, and personnel?
And appointments.
And appointments also.
Yes, please.
Okay. All right. So a motion by Mr. Forsyth to go into executive session, second by Mr. Sheraton. Any discussion? All those in favor signify by saying aye.
Aye.
Okay, so we are back live. If there's no further business, I would entertain a motion to adjourn. Mr. Smithers, second by Mr. Sheridan. Any discussion? All those in favor signify by saying aye.
Aye.